All right, if you're watching this video, you want to learn more about cataracts and cataract surgery, so let's get into it. Hi, my name is Dr. Joshua Cohen. I'm a board-certified ophthalmologist at Cohen Laser and Vision Center in Boca Raton, Florida. Cataract surgery is used to treat cataracts, and cataracts is a clouding of the natural lens inside the eye, which is this structure right here. This crystalline lens basically gets thicker and more rigid and more opaque as we get older, and that process eventually leads to the formation of a cataract where the entire lens becomes so opaque that you can't see through it and needs to be surgically removed. Now, why does that happen? That happens because the crystalline proteins in the lens continue to reproduce indefinitely as we live. So basically, those layers build upon themselves year after year after year, and as a result, because it's a relatively confined space, it just compacts more densely every year. And that leads to inflexibility in the lens, which contributes to presbyopia. That's the problem where you have trouble focusing in after 40, and for more details on that, I have a video up here on presbyopia itself. But as presbyopia continues, eventually it becomes so inflexible and so opaque that it crystallizes and becomes a cataract. So instead of the lens being clear like this, it eventually becomes cloudy like this. And there's different types of cataracts. You can get what's called a nucleosclerotic cataract, which is a gradual yellowing of the lens proteins, or you can get a more crystallization or a cortical cataract, or you can get opacification on the front or back. Nonetheless, each different cataract sometimes requires the surgeon to adjust his technique, but generally the removal of all of these is more or less the same. I'd say the most common reasons for people to need cataract surgery, number one is getting older. Number two is any previous eye surgery. So if you've had a retinal detachment, for example, there is a very high correlation with needing cataract surgery down the road. General blunt trauma to the eye and the head. So sometimes getting an injury to the eye can cause the lens capsule to become compromised and cause a reaction that leads to crystallization of the lens proteins. So that is another cause, and something to be aware of if you have a history of trauma, because that might be important for your doctor to know, because they might need to modify their techniques to make sure that things are safe. If you have been exposed to steroids, that includes eye drop steroids or systemic steroids like inhalers or injections, that can also contribute to cataract development. A lot of UV exposure, if you spend a lot of time outdoors without sunglasses or eye protection, that can lead to cataracts as well. Smoking has also been associated with it. And then other types of, problems within the body, like high blood sugar from diabetes, or inflammatory conditions that can lead to inflammation within the eye, like psoriatic arthritis or lupus, for example. They can also contribute to cataract development. And the last is probably the least common, but congenital cataracts can also occur. Some people are born with cataracts, and they are taken out by usually a pediatric ophthalmologist or someone skilled specifically with dealing with cataracts in very small eyes. So cataracts are extremely common, and in fact globally the number one cause of blindness worldwide, and cataract surgery is the number one surgery performed in the US every year, with about 2 to 3 million people undergoing surgery. And why is that? Because if we live long enough, we're going to develop cataracts. Doesn't mean they're all going to be visually significant, but most of them will be. Most people start to develop symptoms from cataracts in their 60s and 70s. So what are those symptoms? Well, the first is just a gradual blurring of your vision, where you just feel like glasses and contacts aren't helping you as much as they used to. The second is glare at night. So as the light passes through the crystals in the lens, basically it fragments and disperses, and that causes distortions and glare, and that can be quite distressing for patients while they're trying to drive. The third most common thing that people experience is basically a lack of contrast, where colors become muted or grayed out or yellow, and it's hard to determine subtle variations in color or shade. That's another thing that people complain of. And similar along those lines, because less light is getting through the back of the eye, difficulty seeing in low light conditions, like reading menus while you're out to dinner. If you experience any of those things, then it might be due to a cataract. So how is cataract surgery performed? Well, modern day cataract surgery, most of the time, is performed with a machine called a phacoemulsification machine, which basically fragments and aspirates or suctions the lens material out of the eye. The first step for cataract surgery is gaining access to the lens. So in order to gain access to the lens behind the iris, which again is right here, you have to make an incision through the cornea, and that can be done either by hand or with lasers, with laser-assisted cataract surgery. The second step is fragmentation, where the lens itself is broken up into tiny little pieces, and again, that can be done with a laser or done by hand. And the third step is aspiration or removal of the lens matter or the material itself, and that is really only done by hand with the phacoemulsification machine. And And the fourth step is lens implantation, which is usually with a lens like this. This is a lens that basically is made out of an acrylic or silicone, some sort of hard plastic material. And basically it has little hooks on the end. These are called haptics. And these hooks kind of fold up like this and they're slid into the eye during surgery. Now the type of lens that you choose is up to you and your surgeon and your budget and your visual desires. And there's a lot of complexity and a lot of choice now. So that's a discussion that you and your doctor will have to have a very extensive discussion about is what's appropriate for you. And there are drawbacks and benefits to each type of intraocular lens, and we'll talk about those in other videos. But generally, the steps of the procedure are kind of the same no matter what lens you choose. You basically slide the lens in, seal the wounds, and call it a day. And with modern techniques, you really don't need sutures or glues or anything else. The wounds will seal on their own, and most people get visual recovery within a few days. Now, the total time of surgery is pretty quick. It's usually about 10 or 15 minutes per eye. Could be longer or shorter depending on the equipment and experience of the surgeon. And most surgeries are done under local anesthesia under mild sedation, basically what's called MAC, or monitored anesthesia care, which is usually a little bit of Versed or some sort of mild sedative that's either given through IV or by mouth, or with other anxiety and even pain control medicines as needed. But generally, cataract surgery is kind of painless because this part of the eye really doesn't have any nerves to sense pain. It's just the cornea that needs to be desensitized, and most people can tolerate a short 10 or 15 minute procedure without much difficulty. So generally, because the surgery is so commonly performed and the skill sets needed to do surgery are so carefully reinforced and practiced by ophthalmologists, the surgery is pretty safe. The risk of complications is pretty low, less than 1% most of the time, and that could be due to the inability of the lens to be removed entirely, maybe due to a complication where the support system or the lens capsule, which is a thin membrane that houses the original cataract and the new lens, that support system needs to be opened during surgery, and sometimes that can tear, and that is a problem, and that can cause lens material to fall into the back of the eye, which might require a secondary procedure to remove that. Or maybe the support system is compromised where the lens can't be placed where we want it to, which is called in the bag, in which case we need to move it in different parts of the eye. And sometimes people don't get full visual recovery from that, but most people do get improvement from their preoperative visual acuity. The risk of really devastating complications, which would be vision threatening to the point of blindness, like a severe infection of the eye or bleeding in the back of the eye, is exceedingly rare, less than 1 in 1,000. But nonetheless, those are some things to be aware of if you have conditions that might predispose you to some of those things, if you're immunosuppressed, for example, or a poorly controlled diabetic, or someone with bleeding disorders or poorly controlled hypertension. But in general, the systemic screening for cataract surgery, meaning do you need medical clearance, it's not always required, but it always is a good idea, especially if there's any concern about your ability to lie flat during surgery, breathe normally during surgery, and tolerate the procedure itself. Now, after surgery, most people will be given some sort of eye drops, usually a steroid drop, maybe an NSAID as well to help with inflammation and pain, and an antibiotic. And sometimes those can be given as an injection during the time of surgery or with different implants, and that type of post-operative care is constantly evolving and will really be dependent on your surgeon's preference. So talk with him or her about what they might ask of you after surgery. We often give an eye shield or eye patch to wear while you're sleeping at night so you don't rub the eye, and we limit your activity for about a week where you don't want the eye getting wet and you don't want aggressive physical activity where, again, you might injure the eye or rub the eye or get sweat in the eye, things like that. But for the most part, once the eye is healed, then we can proceed to the other eye, as we generally do each eye separately, but under certain situations, they both can be done at the same time. But at higher risk because we don't have the ability to gain information from the first lens, so if there needs to be adjustments in the calculations, we don't have that information, and theoretically the risk of infection is a little bit higher because both eyes are involved. But when we do bilateral surgery, we really treat both eyes as two separate patients. So totally new sterile field and new procedures and new cleansers, all that kind of stuff. But cataract surgery is a really amazing procedure, one of the most rewarding that we do. And the procedure can be covered by insurance. Most insurances will cover the operation and anesthesia care and your medications, etc., if you meet visual criteria, and that is dependent on your insurer. Meaning if your vision is bad enough or your symptoms are bad enough, insurance will cover it. Now, if insurance doesn't cover it, it could be because your vision might be too good, in which case you can have elective cataract surgery or a lens replacement procedure, and it's the same general technique, it's just you would be choosing different lenses and not having it covered by insurance. So that's a quick overview of cataracts and cataract surgery, a procedure that we do all the time here at Cohen Laser, and really invite you to learn more about the procedure and also different lens options and surgical options so that you can become informed and aware when your doctor says, yeah, it's time for cataract surgery. Well, now you'll know what that means. So if you have any questions, please put them in the comments below. If you've had cataract surgery, share your experience as well. And for more information, visit our website at cohenlaser.com. Thank you again for your time, and I look forward to seeing you in the next video.